This is a very unique hospital because 57% of all the patients that come to Boston Medical Center are foreign-born. We are the catch hospital for all the immigrants and refugees that come to the Boston area. Sadly, torture is practiced in over 100 countries around the world, and there are about 23 ongoing civil wars going on right now. But about 15 years ago, we set up a special center to care for refugees and survivors of torture. You can't diagnose and treat patients from various countries unless you understand their religious backgrounds, their cultural background. For instance, the Somali women are Muslim, and so you need a woman practitioner oftentimes to talk to them about things. Many of them have never seen a doctor. And then, of course, in some circumstances, the doctors in the country were part of the torture. The torturers go through the body to the mind to the soul and really try to destroy the person, which is what we have to rebuild. Oh, here's Yeshe. Yeshe is a very, very famous monk who was a Rinpoche, which is like a doctorate in monkhood. He was involved in the Free Tibet movement and was imprisoned for 5 years and tortured every day, electrocuted and tortured. And he was able to escape. I know that we've been working on your back pain and your knee pain. Many cultures, people don't talk about mental health depression. They manifest it as back pain and chronic total body pain. Psychotherapy, I found, not only didn't help people, but it made them worse. Talk was not helpful. Because they have chronic pain, we decided to try to use acupuncture. Move down a little bit. Okay. Okay, Yeshe, we're going to put in the needles and then let you rest, and then we'll do the back. Well, acupuncture is an ancient tradition. There are channels, much like blood vessels, that run through, which are energy channels. They go throughout the body. Deep breath. We use the needles to stimulate or to tone down the various chi channels. And what we know is that there are neurotransmitters that are released. There's mechanical changes that occur at the fascial level. There's electrical changes. So we don't know all the details, but that's true of most medicine. But whatever it is, I mean, there's a physiological thing that's going on. The NIH, by the way, has said that, for pain syndrome, that acupuncture definitely works for back pain, for headaches. Cupping is another way of getting the energy to the surface. Show me where it hurts. Okay. This is cupping, which brings up the blood, you can see, but it brings up the energy and it causes circulation to the area which is stagnate. So a lot of the back pain is stagnation. So what we're trying to do is get things broken up and moving. And cupping is used not only in Southeast Asia, which of course is well known, but in Europe, Eastern Europe. A lot of people, you'll say, oh, my grandmother used to do cupping. Feels good actually, even though it looks like it doesn't. Yeshe, you okay? Yeah. Oh. It's a funny notion to call this complementary and alternative medicine when this is traditional medicine from where they're from. Western medicine is alternative medicine. But we don't see it as alternative. We don't even see it as complementary. We see it as integrative. So the Western and the complementary medicine are used together. Okay, Yeshe?
Yeah, thank you.
Good.
Yeah.
Good. Tashi Deleg. Mental health is a funny notion to most people around the world. And one of the things I tell them is that what's happening to you, the fact you have nightmares, is normal. It's a normal reaction to some horrible things that happen to you. Now we have to try to get beyond it.